Warm welcome. We're now 4 minutes and 30 seconds away from kicking off the English language sessions of Teach to Reach. I'm here, of course, with Charlotte and Boo, and it is our emceeing duo that is going to facilitate this session, of course, with, you'll see, an impressive number of participants today, and it's 4 minutes away. If you are hopefully by now participating in Hopin, and if so, you'll see that you'll go to the stage, and that is where you'll see it light up. You should be able to see it, and you should be, whoops, okay, there's a glitch here. Obviously, I'll just reload the page here. So don't panic, there are glitches in this conference platform, and you'll see what happens if I click here. Okay, well, here, this is where, when you're in Hopin, you actually watch the plenaries. Now, some of you are already in our Zoom studio, and that is fine, especially if you're an invited speaker. That's really the best way to participate. But we're now 3 minutes and 30 seconds away. We'll need your energy, your inspiration. We just finished a grueling 4 hours with the Francophones, but wonderful, amazing sharing of experience. And many of you, many of the Francophones spent the morning networking with each other. So see you soon. 3 minutes. Welcome back to Amel El-Taher. Good to have you back, Amel. We missed you, as many of you have now. We've known each other. We've worked together for years, and others are brand new, are attending Teach to Reach for the very first time. We think that's very, very exciting. With Charlotte. Charlotte, how are you doing? How's your energy?
Hi, Reda. My energy is quite high. I can't wait to start this session of Teach to Reach Connect with the English speakers.
That's the spirit. All right. Et pour Dadou Mwepou, malheureusement, les séances en français, c'était ce matin. Merci de consulter le programme. Just telling the Francophones who are here that they should check the program, because check the schedule, because the sessions in French are now finished for both networking and plenary. So everything this afternoon in the next 4 hours, I think, will be in English. Here we go, 1 minute, 40 seconds. Starting in just 1 minute, we're starting the final minute countdown for Teach to Reach Connect 6. Today is the 17th of June, 2022. And I'm very pleased, honored to be here with you as your Master of Ceremonies, with my counterpart, Charlotte and Boo, Mistress of Ceremonies, will be the two MCs guiding you through Teach to Reach 6 this afternoon. But many of the interactions will be taking place with each other in the networking and in the group sessions. So look forward to those as well, and hope you've made it to the Hopin platform. "20 seconds remaining. You can count down with me. And 15 seconds. And now 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. It's hard to believe that this is already the 6th time we're meeting as Teach to Reach Connect for Teach to Reach Connect. This is a big day, not only for Teach to Reach, but also for the movement for Immunization Agenda 2030. Remember, It all started when we asked this question: what is the future of immunization? Just after the World Health Assembly had adopted unanimously the world's new strategy to achieve the goals of immunization and contribute to the global goals. On the 7th of March, over 6,000 health professionals from 110 countries committed to contribute to a global movement for Immunization Agenda 2030. We launched a call together to join the movement for immunization, and through this call reached what is now 45,641 people. This is not only about the connections, the information we send you, the connections we make with you. It's about the connections you make with each other. And that is key to what you are going to do today at Teach to Reach with the networking. On March 7th, we launched the first full learning cycle. And this is a continuum of action from knowledge acquisition. Knowledge, the best available global knowledge, is absolutely essential, but it's no longer sufficient to lead to change. And so we asked you, do you face any of these challenges? And I'd like to do that again today. Whether you are watching on YouTube, Facebook, whether you are on the Hop-In platform, as you can see here, wherever you may be, let me just, here, wherever you are, I would like you to type yes into the chat. If you, or into the comments or whatever you have available, if you have any of these challenges. So children who are unvaccinated, missed communities, epidemic outbreaks of measles, yellow fever, other diseases, lack of confidence in vaccines by the community, marginalized community that is hard to reach, or gender barriers in immunization. We challenged you and we said, well, if you face any of these challenges, join the movement to tackle these challenges together. And this is what we did with 8,377 people, health professionals from all over the world who joined the movement. I'm now going to ask Charlotte to read the pledge that each member of the movement, every scholar, has made. We call it the Scholar Pledge.
Hey, Rena. I am committed to work for a world where everyone, everywhere fully benefits from vaccines to improve health and well-being. As a scholar, I hereby solemnly pledge to work with others to transform projects led by scholars into action and results that will improve immunization outcomes, to share my success as well as my challenges by reporting on a regular basis on my progress towards implementation, support fellow scholars in doing the same while upholding the highest standard of integrity and behavior. I make this pledge for the health of children and families in my country and everywhere. Thank you.
So here we are after 16 weeks, and today is the day when movement members who've been active in the last 4 months complete the first full learning cycle. Now, the first part, this is before the formal opening ceremony of Teach to Reach. And it started, we got the idea because during World Immunization Week, we asked you, could you share a photo of the work you are doing in the field? Show us what immunization work, daily work, looks like. And you shared over 1,000 photos. So we've now decided to inaugurate, and we're doing it today, right now at Teach to Reach 6, the first Immunization Agenda 2030 photography exhibit. Of course, it's online. You will find it on Instagram. I'll let Charlotte share the link if she has it. What we want to do, two things, is hear your stories. You shared the photos, you shared a little bit about the stories, but Charlotte has invited some of you as speakers to speak specifically about your experience in relation to these photos. So I'm going to, I'll do the Instagram, and before we kick off the slideshow, we're going to see if you were invited as a speaker to join this session. Please raise your hand so that we can hear your story and hopefully show your photo as well. Charlotte?
Well, I've invited Anu Loapo Raji Philip, who was invited, but I see Joy Ataodi, Dr. Joy Ataodi is quicker. So Dr. Joy, over to you.
Hello, thank you, Charlotte. Thank you, Reda. Good morning, everyone. My name is Joy Ataodi from Nigeria. I am a university lecturer, but an ad hoc immunization supervisor, senior management staff. So I work at the national level, but I go to supervise immunizations at the rural level too. So in this picture, I'm finger marking children that have been successfully immunized. So that's what I'm doing in the picture. And this picture was taken in Kebbi State of Nigeria, in one of the villages in Kokobese local government area. Thank you.
All right, wonderful. Let's have a round of applause. Finger marking children following immunization activities. It is part of a collection of photos that you can now go to Instagram, to the Geneva Learning Foundation's account, to see. Of course, there are photos of the movement for Immunization Agenda. And to kick off this session, even before we do the formal opening ceremony, I suggest, without further ado, that we launch the slideshow. We are going to then mark a pause to listen to more of the speakers who've been invited to contribute. Let's go. Stanley Jasmiel from Nigeria. Ismail Garba Majewa from Nigeria, largest country team in the movement for Immunization Agenda 2030. So do not be surprised, and we honor our Nigerian colleagues for having such a strong presence in the movement. Dr. Mufakir Mian from Pakistan, another very strong team. Hadiza Saleh from a health center in Nigeria. Babu Kika Anita from Uganda. Stanley Jasmiel from Njaya Health Center in Nigeria. Vishesh Kumar from Nepal. Mandi Municipality Brick Factory, reaching the unreached through M&E. Jane Rebecca Oluwak from Bondo Sub-Country Hospital in Kenya. Farhan Ali Mohammed from Hammamet in Tunisia. Jane Rebecca Oluwak. Florence Derry, community nurse, giving immunization to prevent VPDs. Hassan Shanzu from Maslish Noor in Kenya. Emilia Sari from Tomefa, hard-to-reach community in Ghana. Dr. Mohammed Mukhtar Ali from Istanbul, working Istanbul IDP, internally displaced people in Kismayo, Somalia. Emilia Sari from a church in Ghana, doing health education for women on the importance of COVID-19 vaccine. Audu Musa from PHC Malam Fatori, Nigeria. Gambo Isa Mohammed from Aminu Kano Teaching Hospital, engaging the public on the importance of immunization. Emilia Sari, yes, many movement members shared more than one picture. I know that Annika Scott is here and she shared 10 or 11 pictures from Guyana. But this shows this is a way of feeling the sense of belonging. We are working together towards the same goals of ensuring that every child, every family is protected from vaccine-preventable diseases. Mohamed Sani Rahamat from Nigeria. Emilia Sari from Ghana. Aminu Demas Mela from Nigeria. You can see from different parts of each country. Sebube. Peter Mawomenyo from Ghana. And let's mark a pause here. Charlotte? Who shall we hear from now?
Yeah.
I see many hands raised already.
Many hands raised, and we have Oluwapo Raji Philip, whose mic has been open for quite a while now. So I'll just invite her to go ahead.
Yes, good afternoon.
Good afternoon. Please introduce yourself and tell us about the photograph that you shared.
Okay, but it's not the one on the screen. Okay, my name is Anula Koraji Philip. I'm a medical microbiologist and also health and safety environment personnel. I work with United Nations volunteer. I'm from Nigeria.
So your picture hasn't been published yet, Anualopo. It will be, but we received 1,000 photos. So you're going to have to help us visualize what we're not going to be able to show today. What is your picture about? What is the story that you shared through it?
Can I share my screen with you?
Unfortunately, no. It is not possible to do so in our Zoom studio.
Okay. The picture that I posted is about myself and my team. After our shift, we took a photograph, and it's just talking about our work as a health and safety personnel. Our work is to conduct and to make sure that the environment is safe and conducive for everyone. And also we carry out COVID-19 campaign for COVID-19 vaccine, and telling the community people about the importance of COVID-19 vaccine and how and they should get their vaccine, and also try to clear the air concerning the misconception about the vaccination. So that was the
wonderful, Anualopo. Let's resume with the slideshow, and I just shared the link to go view the photo exhibit, the photo exhibition, the first one coming from the Movement for Immunization Agenda 2030, and keep checking the Instagram account, as your picture will be there soon. That's
okay. Thank you.
Thank you. Magachi Garba Adamu, Mohammed Thomas Morley Calais, the COVID-19 Vaccination Center in Sierra Leone. Rosemary Jimmy from Public Health Laboratory in Nigeria. Nasheed Abubakar Zuba from Ibre Village in Nigeria. Raimi Marufu, I know he's in the room. Yunana Ishaya Abila, General Hospital in Nigeria. Magaji Garba Adamu. This is one of the more striking pictures showing the work of immunization reaching whoever needs to be reached. Nasiru Ibrahim Sarki Zoaka, Dr. Imran Khan from Pakistan, and Tina, facilitator who I know attended Teach to Reach for the first time, Teach to Reach 5. I hope that she is in the room. Ubagu Martha Amuche from Anambra State, Nigeria. Joseph Kaku from Ghana. Najiba Hassan Usman from a PHC facility in Nigeria. Murtala Isuaku from Katsina State, Nigeria. Sunil Raja from Pakistan. Atahu Rayanu showing the work during an immunization and nutrition assessments. Carlos Funzamo in Milonge District in Mozambique. Mohamed Babubakar, Nigeria. Adefunke Marufat Adesina. Dr. Abdul Samad Khan Sandrani in Pakistan. Fabia Hanan Mone from Bangladesh. Dr. Joy Cecilia Atawozi. Leonard Oduor Otieno from Niali Dispensary in Kenya. Abdikani Hassan Ahmed, Odwain Hospital, Somaliland in Somalia. Abdi Jamal from the Bab Refugee Camp. Another very striking picture. And let's mark a pause here as we're going through the very first photo exhibit of the Movement for Immunization Agenda 2030. I'm going to share the link. You can click on it, stay in the Zoom studio wherever you are, but that means you can also go and subscribe or follow the photo exhibit, as we've only shared a few of the 1,000 photos that we've received. Almost a perfectly round number. Charlotte, back to you to help us choose the next speaker who will share their photo.
I would like to invite, I've invited amongst those who Santa raised, Pascal Okoye-Ocha. Are you able to unmute yourself and tell us about the picture that you shared?
Yes, I have. Thank you, Charles.
And please do start by introducing yourself.
Can you hear me?
Yes, loud and clear.
All right. My name is Okoyo Pascal Ifani. I'm a pharmacist with Regina Cheli Specialist Hospital, Oka, Anambra State, Nigeria. I also volunteer with Mission Africa US, United States of America. So the picture I shared was taken in April 2022, that's this year, when we had our outreach in Ezag. Ezag is a town in Enugu State. So we educated the people on COVID-19 vaccination to break the hesitancy because we found out that the people were not ready to take the vaccine because of the misconception and everything. So we helped to educate them on what to do, and we encourage people to get vaccinated. It was a 3-day program, and one of the most rewarding. We saw them available and willing to take the vaccine after the day. So, and I look forward to more programs like that. Thank you.
Dr. David Kajovo, and thank you for sharing your story. Your photo will be published soon. Keep checking the photo exhibit. We're using Instagram for this. It's easy, should be easy for everyone to go to and follow. Dr. Priyanka Bajaj from Southwest Delhi, India. Adamu Yakubu Babansora from Kaduna, Nigeria. James Sado in Gudna Village, Nigeria. Beatrice Adwoa Afari from Nia Shale Health Center in SDA Church, Ghana. Samuel Majang from South Sudan. Bernard Acheompong from Rabaul Town Clinic in PNG, Papua New Guinea. Syed Miravan Shah Syed Zai, Tani District, Coast Province in Afghanistan. Magaji Garba Adamu, Takai, Nigeria. Syed Razi Abbas did a photo montage at the Union Council Tatha Gurmani at the bank of Chenab River in Pakistan. Omorodian Loveth from Uromi Health Center, Nigeria. Abnet Samuel Abillo from Dumaran Municipality in the Philippines. And now this is, you can see photo 361. There are more pictures, they are in French. We're also translating so that you'll be able to enjoy and discover what your neighboring country colleagues who are francophones are doing and what immunization looks like, where they work. Now back to you, Charlotte. I see many of our speakers have their hands raised.
We already have Henry Debandeke, whose mic is unmuted. So Henry, can you go ahead? If not, I'll turn towards Musa Abdullahi Sufi.
Yeah, Musa Abdullahi Sufi is here. Can everyone hear?
Yes, we hear you, Musa Abdullahi Sufi.
So, is it good morning or afternoon, everyone? How shall I put it?
It's a little bit of both. We've got people from all over the world in the room and in Teach to Reach.
Yeah. So it is morning, evening, afternoon.
Yeah, so tell us, now your photo, Musa Abdullahi, has not been published yet in the first Immunization Agenda 2030 photo photography exhibition. So you're going to have to help us imagine it, and we'll have to keep checking the Instagram account until we can see we can see your picture there. What story did you tell? What did you show? Where do you work? Who are you? What do you do? A lot of questions all at once.
Okay, yeah. Currently, I'm heading a program under a foundation called Adma Barroso Foundation, and also doing a consultancy on the vaccinations campaign with the Breakthrough Action Nigeria. And I'm also doing a lot of work with the CSOs and supporting government at my voluntary capacity towards mass vaccination in Kano and in Nigeria. So particularly, one of the means I use for promoting the vaccinations across the states where I am and beyond is using the social media platforms In every vaccination I received on my own, I make sure I write about it from my first dose to the second dose and to the booster. And many people who are with us on the social media being able to see some of these photos, and from there the trust of the vaccination start coming up. And we also have initiatives like training religious leaders in Kano, for example. When the issue of vaccination start coming, people start mistrusting it, and the vaccinations, creations, testing, piloting, and all that stuff. So they realize, in fact, including sharing some of the what some Muslims around the world are saying, how it's justified for Muslims to be vaccinated, even during Ramadan. So those kind of messages were also taken forward. We shared from our own social media platforms. We have other influencers, people around. One of the popular one we have in Kano is Zainab Nasir Ahmad. And so we engaged her very well, and she was able to spread the message of the vaccination through also her platform. So that gave opportunity for many, many people to start accepting the vaccines. That's why part of our contribution is in Nigeria today. Kano is the largest, with having the largest number of vaccinations in Nigeria as a country. So using social media is a platform, religiously is a platform, and also any forum we find ourselves, whether it has to do with vaccinations, on health, on nutrition, on dancing, on creativity, we make sure part of the discussions we integrate the issue of people need to be vaccinated, and we show ourselves as examples. Some of us are becoming more healthier. So opportunity I have working with the foundations and also consultancy with the Breakthrough Action Nigeria also give me the opportunity to, trumpet the importance of being vaccinated wherever you are. And I tell you, many people, including artists that we have in the country and other people that we can think of, some of them not even educated, but because we have this contact of community mobilizations that we engage people on different platforms, we're able to influence that. So I realized that taking the vaccinations, using opportunity to also take the vaccination to the people is a key way in this region and this part of the world that makes many people to be vaccinated, because some people feel very lazy to go to the hospital or to the vaccination side. But when you work with the governments to be able to carry these vaccines, and even people who are into testing, to go to the same community, and you go with the mobilization, getting people around, speaking to people, and they see your face. Because I've been involved in too many things as a versatile person, including acting in our own house of movie industry. So people can accept that what you said, and then they easily that. And we also engage radio. We usually every month I've been involved in a 1 hour, 30 minutes radio program in any kind of different issues. So during those issues, I also use that opportunity to remind people about the importance of being vaccinated. And many people ask questions, and we clarify where thousands and thousands of people, especially in Kano, when you're on a radio program, an average of 1 million and above people are listening to that program. So when you do that, other people hear some questions about the fear of the side effect of it, and then you clarify some of these things. So you give a lot of hope, and more people accept the vaccination. And also including engaging the health workers, because we realize some of the health workers are not vaccinated, and people who are working in the hospitals, they're not vaccinated. So when you start engaging this kind of group of people, they even become ambassadors when they realize that this thing really doesn't have the side effect. All the messages they received that been seen from the people with their people from Europe who are saying the vaccine is dangerous and that, and then they see you get vaccinated and you talk to them, you give them reference. Many people, including the president of the country, the governors, the ministers, who have received their own, and they are still functioning very well. So through that, we were able to do that. So using pictures in all the activities, in all our statements we do to motivate people more, and also responding to some of their questions, is really been an eye-opener for more people to accept vaccination seamlessly without troubles. In fact, in Kano, we do even vaccination during Ramadan. As people see, Kano is a very religious society, but then when people understand this is what it is, that it is not, there's no problem if you're a Muslim during fasting period, you can receive your vaccine, it doesn't break your fasting. So that also allow many Muslims even get vaccinated during Ramadan. So this is my little story.
Thank you, Musa. There's an invitation from the Nigeria team of the Movement for Immunization Agenda 2030 for you to join them. You can contact Emmanuel Musa. who you can find in the chat here. We only have 5 minutes left. I know there are several speakers who have not yet had a chance to present. We have, for the very first time, a mechanism by which every speaker will be able to contribute their story, and every story will be shared with a full list of participants of more than 12,000 people who registered for Teach to Reach Connect 6. So I suggest we spend the last 4 minutes looking at the final set of pictures. You can go and look at all of them that have been shared so far on the first Immunization Agenda 2030 photo exhibition. And I believe Charlotte is going to read, give you a little bit about these photos as they go by. Charlotte?
Okay, Reda, this is Faith Eyage Ugba, that's from Igbeti, that is a local government area, Oyo State in Nigeria, displaying a vaccination team and the vaccinated eligible children. Here we have Atola Toki, that carrying out NID monitoring and routine immunization activities monitoring in Kandahar province in Afghanistan. This is Jesupe Miwale John Adenji from the Isokan Estate Akobo community in Nigeria. Here is Musa Baik from the Naga district in Pakistan. That is during the Immunization Week celebration. He was working activities. All right, let's go forward. From Daniel Kwesi Ekam from the Upper West Regional Hospital in Ghana. That is shows supervision of 2 nurses undertaking COVID-19 vaccination earlier this year. Rukaya Mumuni from the West Municipal Hospital in Ghana. That is doing a health education on the importance of vaccination. We have here our very own Emmanuel Musa from Nigeria. That's giving a health talk to mothers and caregivers before the start of an immunization session. And here is Sitsofe Ahmed Boy from the Vakpo community in Ghana. The picture showing a target group with children and their parents and guardians in the community, and that's helping to mobilize these caregivers and their children for immunization. From Sri Lanka, that is captures a moment at the doorstep of during a COVID-19 vaccination campaign supported by the Sri Lanka police. Okay, we have here Susanna Okwakola from Agurut Health Center in Kubi district in Uganda. That's giving health education and sensitization. Another picture from Emmanuel Musa from Kaduna State in Nigeria. Here we have Dr. Sikanda Ali Somro from BHU Kabalo district in Pakistan. So it shows supportive supervision and monitoring of immunization week. That is a child that is receiving a much needed vaccine, and you can continue to see more of these pictures using our Instagram channel. All right, we have Dr. Zahud Bado.
All right, thank you, Charlotte. We have there many more pictures, and you can go see them all in the photo exhibit that you'll find on Instagram on the Geneva Learning Foundation's page. Please do follow, because there are many more pictures if you haven't seen your photo yet. And then for the speakers who did not get to speak today, we are going to share with you the mechanism through which you'll be able to share your story, and it will be shared with the more than 12,000 people registered for this amazing event. So stay tuned. And we're now going to focus for the next 30 minutes or so on the practical aspects of Teach to Reach. So especially for those of you who are here for the first time, we have another 30 minutes to go before the formal opening ceremony. And you should be by now in Hopin. And so I'm going to take you through the process. If you're not there yet, I'm going to show you step by step what you need to do to actually get there. So we'll be starting from scratch here, but you should be here. And you can see here there's Melise Teferi who says hello. So he's calling in from Addis Ababa, Ethiopia. Abeba Sorsa, also from Ethiopia, MOH, Hawa Buhari from Sokoto State, and Dwayuto Azugo from Nigeria. And as you can see, there are many, many more people joining via social media, as well as our speakers who are in the Zoom studio and movement, IA 2030 movement leaders and others. So now I'm going to show you the practical steps to actually register for Teach to Reach Connect. And Charlotte, what would you like to say? Do you have a word of encouragement for people who are joining Teach to Reach for the first time and who've struggled, who couldn't figure out what is hop-in, how do you register, what is a ticket? Is there anything that you can say to reassure and encourage them?
First and foremost, Fred, I want to say a warm welcome to all those who are joining us for the very first time. And then secondly, I want to say you are joining the biggest experience sharing event that among health professionals that you could ever join. And you have two possibilities for experience sharing. We have the plenary sessions here in Zoom, where you listen to experience of others, but there's the special experience sharing that takes place in Hop-In on a one-to-one basis. So what I'd like to tell you is follow keenly to every step that Reda is showing you if you have not yet got to your ticket or registered to Hop-In. It's simple, it's straightforward. If you're having connectivity challenges, I advise you, maybe you may have to make a choice. Either you listen to the group experience sharing here in Zoom, or you go to Hop-In and then you can juggle between the stage and the networking. That way you listen to the plenaries on the stage in Hop-In, and then you can benefit from the networking with peers that are also there. Thank you, Reda.
All right, great. So what is Teach to Reach about? First thing is, here you can see how a participant of the very first Teach to Reach Connect summed it up. So he said peer learning is the key to success, and networking is the key to peer learning. Now, we've seen over successive editions, this is the 6th quarterly Teach to Reach, and Teach to Reach Connect 4 already had 6,163 people registered, including 3,445 Anglophones, as you can see here. Teach to Reach 5 had 8,584 health professionals, immunization professionals registered. And I'll let you guess, imagine how many have joined Teach to Reach Connect. 6. And this was the number this morning. 12,398 health professionals. And for the very first time, Teach to Reach has opened up to health professionals working outside of immunization, as I'll be explaining in a minute. Now, for the networking, for the entire event, check your inbox, take the time to read the emails. You'll find a discussion guide that covers all of the sessions that are happening today. Each edition has really 2 tracks. On the one hand, you have plenaries and concurrent sessions. So that's what we're in now. Right now is a plenary. If you're in the Zoom studio, but you could also be on the stage in Hop-In, or you could also be watching on YouTube or Facebook or Twitter. We want to meet you where you are. So we do not force you to register, sign up for a platform. Now, that is for the plenaries. Then you have the networking. And that can only happen in one place because of a special technology that's needed to support it. And that is in the Hop-In platform. So if you haven't done so yet, well, I encourage you to go look at the link I'm sharing now. And I'm going to show you the practical steps to actually join in this Hop-In, so you can participate in the networking and get the full benefit of the of Teach to Reach. Now, you can see the full schedule here, so let's actually go there and have a look. So as you can see here, if I scroll down here, I have the schedule right here, and if I click on schedule, then this scrolls down. For those of you who couldn't figure out how to get the English language, right now there's only English language sessions left. I think there's a couple that were not okay. Actually, right here, it's once you register that you can see the live information. So here we've just finished the slideshow, as you know. Whoops, I'm trying to scroll scroll a little bit, but it seems I can't. So you can see this is in English. Now, second is right now, this is the session we're in now. and then you can see the following sessions. But in order to see what is live, what is happening right now, you do need to register. So I'm going to show you that process. It starts by clicking on the register button. Now, some of you have gotten sort of these bizarre errors trying to sign in, and it's usually because, one, you already have a Teach to Reach account, in which case you need to use the little sign-in link. If you already have a Hopin account, so that means you participated in Teach to Reach before, you need to sign in to register automatically. Now, before you click on sign in, you do need to choose the ticket that you're going to use. All the tickets are free for country-based health professionals. And so here you can see this is for English speakers. Don't accidentally click on Français or only click on bilingual if you actually speak both English and French. Otherwise, you're going to find yourself in networking meetings with people who speak a foreign language that you may not master. So what you want is click on English. All right, you can see it's lit up in blue. And then I'm going to click on continue. And here I'm going to click here. I'm going to put in my email. Oops, okay. And guess what? I get this funny message. You can't assign a ticket to this email. Now, this is completely cryptic, but this is because I already have a ticket. So what I'm going to have to do is actually sign in. But for the purpose of this demonstration, I really want to speak to the participants who've never participated in Teach to Reach before. So I'm going to add a little tag here that will get Hopin to think this is a different email. I'm going to register here, and then you'll see that's it. I'm done. I've registered. I'm going to Teach to Reach Connect. You can see the time here. And then here's the key. You don't need a password or anything like that. The email is sent directly to you. And I'm going to show you this email in a second. Charlotte, any questions, anything you'd like to share on this registration process? It is not the simplest process in the world, but it does work when you come down to it. What's been your experience? What tips can you share with our colleagues?
Really, I think you have said everything, Reda, but it's really important to find that email because it's like the key that gives you access into the event. And it's almost immediately, as soon as you register, you get the email that is asking you to join the event. So if you have not yet been able to access and you already clicked on register, maybe you were following as Reda was doing so, go to your inbox now and find the email with the subject, "Thank you for registering to Teach to Reach Connect 6." Once you get that, there is a blue link. You click on it, and then you are in. Reda, comments in the chat are still about the photo stories. Some people, They really want to share their own photos now. But I think the opportunity is we have the Telegram channel where you have the opportunity to continue sharing your pictures.
And the other thing people can do is if you use social media, so if you're whatever it is, Twitter, Instagram, just tag the Geneva Learning Foundation and we will reshare it as an IA 2030 movement photo. If you're a member of the movement, that you can include your story with it and they will go out that way. The stories we've selected are those where people gave us a specific, we asked for specific permissions. We asked to make sure that every person in the picture that you've secured their consent to share their picture and so on. So that is why we cannot simply collect sort of random pictures, but we can reshare and like the photos, and we'll certainly do so. Now, to the task at hand, we want to find that email. So the email says, "Thank you for registering for Teach to Reach Connect 6." And then you scroll down and you see Enter Event. And that's it. It doesn't even ask you for a password. You don't need to really create an account. All you need is this email that is different from what's shown in the tutorials, in some of the older tutorials, because Hopin has upgraded. So that is how you can actually make it through to Teach to Reach. Now I am in. So as you can see, it's quite different. You have the stage that is live. So let's go have a look there. And guess what? This is where you can actually watch the plenary. Now, if you're watching on YouTube, Facebook, Twitter, or in our Zoom studio, this is actually a better place to go. You can see that Samuel Maloga has left a nice message. Hello, Samuel. Subarna Sinha Mahapatra from West Bengal has also left a message here. And you can share messages. There's more. You can look at our Twitter feed where we've got some members of the TGLF team who are sharing what is happening in the conference that is on the stage. And then you've also got the event chat. Okay, so here we have some Francophones that are still talking. You'll see, I'll show you the other areas, but the most important thing, so you know where to go, where you want to go, is to go look at the reception. So what's in the reception? Here you have a description, and then you have the schedule. But here you can always find this black rectangle, says stage is live now. And this will change as different things are go live. Right now, if we go to the stage, you can watch this plenary. So you may already be there. If you're there, that's fine. You see go to stage. But here is, you see now the schedule is live as well. It shows you what is happening now. And this is important because after the opening ceremony, there will be 2 or 3 sessions running parallel at the same time. So this is just like in a physical conference, you will have different rooms. And so you're going to have to make choices, decisions about which room you want to go to. But right now, this tutorial is the only thing that is running. Now, the next session, you can see starting at 2:30 p.m. Geneva. If the clock on your computer is set correctly, you should be able to see your local time when you view the schedule. So you may see a time that's very different from what I see, which is the time in Geneva. And here you have the opening ceremony. And now here's what's kind of neat. If I'm interested in this session, I want to make sure I don't miss it, I can add it to my agenda. And here you can see that over on the right-hand side, you have something called My Agenda, and I've just added the opening ceremony now. And I can do this, I can go, so I encourage you to go now to Hopin, get your ticket, because otherwise you're going to miss a very big part of the conference experience. Choose, for example, I know that many of you are most interested in the session on building confidence in COVID-19 vaccines, so I'll add it to my agenda as well. Networking, 1, how I overcame my challenges to improve healthcare in my community. That's for the IA 2030 movement members. Now, these 2 sessions take place at the same time. So you have 2 options. You can really make a choice. Say, okay, I'm going to the plenary. I'm not going to the networking. Or you can move back and forth. Many participants sort of stay in Zoom, keep an ear in Zoom on one device. You can do that on your phone. And then on their laptop, they go for the networking. And the networking is really probably the real thing that differentiates Teach to Reach from a lot of other information-focused events, because it is about peer learning in a way that is different from the plenaries. And that's what I'm going to show you next. Charlotte, any questions or specific points you'd like to add before we show networking to the group?
No, rather no comments or particular questions in the chat around this particular segment.
Okay,
so
great.
We can proceed.
All right, so here, now this is new. Even if you've participated in Teach to Reach before, this is completely new. And it's really nice. You're going to see it. Networking is now called People. And so if you want, for those of you who've done Teach to Reach before, used the Hopin platform before, you've got the speed networking here. And that is where you go in. I'm actually going to do it. Maybe there's somebody already. There are probably already people networking. Let's see if we can get someone. You see, I just click on the join button and I'm randomly matched with Dr. Bala Ganesakumar. He's probably going to be surprised to see me. Let's see if he's going to answer. Okay, I'm going to turn off my webcam just because that's very confusing. Dr. Bala, greetings. This is Reda Sadki. I'm actually speaking to you from the plenary, sir. So warm. I'm doing a demonstration of the networking. Can you tell us, has the networking worked for you? Have you been able to network with others so far?
Yeah, thank you. Thank you, Reda. Can you hear me?
Yes, loud and clear.
Yeah, I want to introduce myself. I am Dr. Bala Ganesh Kumar, working as a surveillance medical officer in India.
All right, honored to meet you. And so if you will allow me to use this session to demonstrate how networking works, I just want to show participants, especially those who are in Teach to Reach for the first time. You can see there's a 5-minute clock here. And so it's a 5-minute timer, but you see as it winds down, you'll have the opportunity to extend the time. So you can actually have quite a long, detailed discussion. Remember, we shared discussion guides on specific themes. So once you've met, once you've sort of chatted socially, you can dig into the topics. And then Dr. Bala seems like someone, fellow professional that I would very much like to keep in touch with. In that case, I click on the connect button. And now this is important. He will have to reciprocate. Both parties in a networking meeting will need to connect. Otherwise, you will not get the contact details for Dr. Bala. So Dr. Bala has to say, yes, I'm interested in staying in touch with Reda Satki in order for it to work. And then in some cases, you will have to try 2 or 3 times because of connectivity issues. And if it doesn't work out, if the meeting doesn't work out for any reason, you can leave. And Dr. Bala, thank you for your helping with this.
Thank you, Reda.
Thank you. And I'm going to leave now. I have asked to make the connection with you. Take care. All right. And so I leave now. And once you finish one meeting, you can go on to the next one. But that's not all. There is something new in this Teach to Reach for the first time. And you can see here that there's an artificial intelligence engine in Hopin that has looked at your profile and that has determined that these individuals, you may be the ones that you're interested in connecting with. So you have some recommended connections and say, for example, okay, so TGLF is recommended to me. I think that's a pretty intelligent AI. I can send a message to TGLF. So I'll go here and use, right? And there you go. And I can also invite TGLF to an instant video call or request a meeting. So these are new available options. Tell us if you're being spammed, if this is not helpful. We will turn these options off, but we wanted to try it for this Teach to Reach, knowing that there are going to be many of you connecting. The speed networking is completely random. The recommended connections, you can actually read through the individual profiles and choose to reach out to someone if you see someone that you particularly like to engage with. So this is a new, a new step in the, in the networking, less random, more focused on helping you connect with the right people as just connecting with individuals to hopefully take a chance on having interesting conversations. Now, that's for the schedule, and that's a quick overview of Teach to Reach, but I'm eager to introduce our partners and the specific sessions and plenaries to give you a good sense of, to help you get a sense of what is going to happen this Teach to Reach. So first of all, very pleased to announce UNICEF as a partner for Teach to Reach ahead of UNICEF's COVID-19 Vaccine Demand Global event, together with these other partners that you see at the top. So the American Centers for Disease Control, the Collective Service, Gavi, USAID, IFRC, and the World Health Organization. Now, so 5 days after Teach to Reach, this global event will be taking place, and I'm pleased to share that every participant of Teach to Reach who shares their feedback on the topic of COVID-19 vaccine demand will receive an invitation to this global event to actually attend the event. So that is a big announcement. We'll talk about it more during the COVID-19 COVID-19 vaccine demand plenary session, but that is big news. And then second is the second plenary, which is the plenary that will be led by the Women Who Deliver Vaccines Collective. And so this, you will hear stories of overcoming gender barriers, and you will hear women who deliver vaccines speak in their own names, but they have invited men who deliver vaccines to share their solidarity and share their own experiences in challenging gender barriers. In addition, this plenary is being done in close collaboration with the Zero Dose Community of Practice established by Gavi. So those are two of the major partnerships and sessions in this Teach to Reach. But that is not all, because, as I said, Teach to Reach for the first time is extending beyond the theme of immunization. And we're going to have a major plenary on the neglected needs of women's health, and one specific neglected tropical disease called female genital schistosomiasis. Going to ask Charlotte to sum up what's going to be the purpose and the focus of this session.
Definitely read that. So this particular session, last year with Bridges for Development and sorry, Reda, I was having connectivity issues, so I was joining on another device. But I just wanted to say last year with Bridges to Development at the FAST package, there was this workshop on female genital schistosomiasis that was organized, focusing mainly on Ghana and Madagascar. And so, but we opened the invitations to other countries, and we had over 300 health professionals that joined and took part in this exercise. They developed action plans, took part in an impact accelerator, and they'll be coming today during this plenary session to share their experiences. What have they been doing since the last FGS Impact Accelerator, since developing an action plan on female genital schistosomiasis. So I would like to encourage you to stay put for that third plenary session. If you have never heard about this neglected tropical disease that affects about 56 million women in sub-Saharan Africa, please join us for this plenary session. Thank you, Reda. Over.
Thank you, Charlotte. All right, now we're going to turn to you. If you'd like to raise your hand, I'm going to lower all of the hands that are raised already in our Zoom studio. Feel free to share. So we have 3 networking sessions: how I overcame challenges to improve healthcare in my community, what I am doing to build confidence in COVID-19 vaccination, that's with UNICEF, and then the third session is how I'm challenging gender barriers in healthcare. If you'd like to share, tell us which of these sessions are you most interested in, and what are you going to share with your colleagues? Charlotte, who shall we hear from now?
I've just invited Hafsa Diaw to unmute. If not, okay, Hafsa Diaw, over to you.
Hafsat, please do introduce yourself and tell us when you joined the movement, and then tell us which of the 3 networking sessions are you most interested in?
Yeah. Good morning, good evening, everyone.
Welcome, Hafsat. We receive you loud and clear.
I'm Hafsat. Are you hearing me?
Yes, yes, we do. Please proceed. Please speak very loudly. I'm struggling a little bit to hear you.
Hello, are you hearing me?
Yes, we hear you. All right. I don't think it's going to work. Let's go to Professor Becky Tagbo. Professor Becky, warm welcome to you. Which of these 3 networking sessions are you most interested in? Do remind us, introduce yourself, and tell us. I know you joined the movement right on the 7th of March, 2022.
Hi, Reda, Charlotte, and everyone. You are right. I joined in March. My name is Becky Tagbo. I'm a professor of pediatrics and vaccinology at the University of Nigeria. I also work at the University of Nigeria Teaching Hospital. I actually work in the area of vaccination at the facility level, community level, as well as district level, national and international. But mostly I am majoring at the facility and community level. So I would really like to join networking too, which is really a passion for me to build confidence in vaccines, and particularly in COVID vaccination. That is the area of my situation analysis as well as action plan and impact accelerator, and I have success stories to tell. Thank you, and over.
All right, wonderful. Thank you, Professor Becky Tagbo. Who shall we hear from next? Charlotte?
I would like to invite Samuel Malogai Badieka.
Greetings, everyone. I'm Samuel Malogai Badieka. I work in Ghana in a Regional Health Directorate. I work as a health research officer. Yeah, the section that I'm interested is in what I'm currently doing.
Oh, I think we just lost Samuel. Let's see if we can get him back.
And
yes.
As to improve confidence in COVID-19 vaccination, we do go on monitoring and supervisory visit to healthcare facilities and then to the field as well to provide support to frontline staff who are providing COVID-19 vaccinations. And then as part of it, there are sometimes we do meet some people that are hesitant and do not want to take the vaccination. In order to also know why they do, we ask them some few questions, and based on that, we are able to convince them to.
All right, Samuel also seems to have a technical difficulty.
For the vaccination.
But we understand that you're also interested in COVID-19 vaccination. This is likely to be a popular networking theme, but remember, the only way you can access the networking is by going to the Hopin platform. So I've shared again the link, and I showed you how to get the ticket. So hopefully that will be sufficient to get you to where you need to go. I hope there will be, and I see some people are choosing networking session 1 or 2 or 3 as well. So it's good to see that as well. Now there are 3 plenary sessions, And the tricky part is you'll see some of them are concurrent with a networking session. So you may find yourself in the position where you have to choose, you have to make a choice. So plenary 1 is on building confidence in COVID-19 vaccines. And again, Charlotte explained the difference between the plenary and the networking session. So plenary, everyone is together. We share experience. Networking, you meet, you have one-to-one meetings, and you can really have sort of private conversations on these topics. Plenary 2 will be led by the Women Who Deliver Vaccines Collective, but we'll be hearing from men and women about challenging gender barriers in immunization. And then plenary 3 will be on female genital schistosomiasis, which affects 56 million women and girls. We have 5 minutes left to hear this time which plenary session are you most interested in, and then we want you to tell us why. And I'd like to invite Mariama Idris. She's a member of the movement. I know she's struggled with connectivity. I'm hoping she will be able to speak. Would love to hear her. I know she's made a lot of effort to get this far in the movement. Mariama, how are you doing?
Hello, everyone. Hello, everyone.
Yes, we hear you loud and clear. Introduce yourself. When did you join the movement, and which plenary session are you most interested in?
Hello, everyone. My name is Mariam Idris from Kano State, Nigeria. I'm happy to meet everyone here today, and I joined this movement in March. I'm so happy to be here to watch today's session. Thank you.
All right. And which of the plenaries are you most interested in? I didn't quite get...
I'm interested in how to build confidence in people on the COVID-19 vaccine.
All right. Okay. Thank you, Mariam. All right. We have we have 4 minutes left. And so I'm going to go check the schedule to make sure we are on track. And I'll show you. So here I go to the reception, then click on schedule. And I can see here that in 4 minutes, we are starting the opening ceremony, celebrating the movement for Immunization Agenda. Yes.
Thank you very much.
Shumirai Jackson.
Thank you so much.
Go ahead, Mercy. Which plenary session are you most interested in? But do introduce yourself first.
Okay, I'm Mercy Shumirai Jackson. I'm a district health promotion officer from Zimbabwe, Unguza district. I joined the session in March this year, and I'm interested in the plenary 1, which is how to build confidence in COVID-19 vaccination. From the field of my work, which is health promotion, I think this plenary will be very important because it's important to boost confidence in COVID-19 vaccination, to increase the number of vaccinations and reduce the pandemic.
Great. Thank you. Thank you, Mercy. All right. So I think that's it for this session. We have 3 minutes remaining. Just to recap, remember to go to Hopin. And if you are in Hopin, if you've managed to get your ticket and work out the details, please type yes. And if you are not in Hopin, I encourage you, if it really seems impossible to you, stay with us in our Zoom studio if you're here. If you're on YouTube, you can keep watching. At least you'll get the benefits of the plenaries. And yes, so Peter, Sebuabe, Tina, Dr. Martin Mayan, okay, good to see that you're all on Hopin. And so many people hop back and forth between the Zoom plenaries and the networking sessions, depending on what is your inclination. So what you prefer at any one point in time. So we're going to now do a little bit of a switch over to the to change the live streaming links. So that requires a little bit of going to have to briefly interrupt the session. You don't have to go anywhere though. We just have to change the time here to have the countdown work properly, and then we'll get back to the music and start the new live stream.